case number 13. The 25-year-old woman with sickle cell disease is admitted to the hospital for a vaso-occlusive crisis. After several days of bed rest, she develops swelling and pain in her left leg. Doppler ultrasound confirms a deep vein thrombosis DVT. Which factor is most likely contributing to her development of DVT? A. Increased physical activity. B. Prolonged immobility. C. Dietary deficiencies. D. Dehydration. Answer. B. Explanation. Patients with sickle cell disease are at increased risk for venous thromboembolism VTE, including DVT and pulmonary embolism. Factors contributing to this increased risk include the hypercoagulable state associated with sickle cell disease and periods of immobility, especially during hospitalizations for vaso-occlusive crises. Prolonged immobility can lead to stasis of blood in the deep veins, increasing the risk of clot formation. Prophylactic measures, such as early mobilization and, in some cases, anticoagulation, are important in the management of patients with sickle cell disease who are hospitalized or otherwise immobilized for extended periods.